thank you very much for having attended our conference today. Sorry for my voice, but even doing so much sport, you can still get sick. In any case, I mean, it's for us crucial to present you what we could do in order to improve what the Commission does for our own health, and also for recognizing the role of the physical activities. As usual, the Commission is not that good in leading by example whenever it comes to deal with our own stuff. We are so proud to see what our DGs are preaching towards member states and citizens, a bit less proud whenever this must be applied to our own colleagues. But what we do normally, as we do today, is to put in place a system on which we convene the best expert in Europe together with the colleagues who are dealing with the same file on the Commission. So we will want to have a clear picture of what we could propose and to be strong on our own proposal, being able to rely on the best possible expertise and also on the policy that the Commission is putting forward to the external world. Today, we are so glad to have with us Professor Jan Segers, who is when we went on the website with Ashida to find the best possible expert, in Google, there is no discussion about Professor Segers seems to be the outstanding authority in this field. And then we are glad to have with us our own colleague, Israel Christoph, who is the policy officer in DG Education, who is dealing with this same file for member states and public administration. At the end of the presentation, there is, of course, a question and answer session. You could put question on the chat, we will deal with that. And the meeting is recorded and it will be published on our very popular YouTube channel, on which you can find all conferences that we organize with other experts. I don't want to waste your time with my presentation, so I'll leave the floor to Rashida and Athanasios, who are dealing this file at the level of the staff committees, because we work on any possible site on which we can put forward our own proposal. So trade unions, staff committee, co-pass committee. I mean, we do all possible effort in order to get the result. Thank you very much for being with us. And thank you very much to Rashida and Athanasios for having organized this meeting and for Dika taking care of the organization. Thank you very much again.
Thank you. Thank you, Cristiano. Athanasios?
Yes, thank you very much, Rashida. Thank you very much, Cristiano, for introducing this meeting. For me, it's also a pleasure to be to say a few words about the work that the staff committee is doing for the well-being of colleagues, especially through the dedicated joint committee of COPAS, which is the Comité Paritaire for Social Actions. And as social actions, we include, of course, also all the clubs that are dealing with sports, with activity like even dancing, walking, brisk walking, Nordic walking, all these kind of things. And of course, coming from now being now in Brussels, but in the past being in ISPRA in Italy as the European Commission site of ISPRA, and being a member of the COPAS, I can tell you that all the work that is done through this committee is extremely important because we understand it as a factual help that the Commission is giving to colleagues and staff and also to their families. And as a matter of fact, it's not only that we discuss how to distribute the money, but then we have also to be accountable and control how this money was spent, if it was for the best interest of our colleagues. So it's a dual role that we have there to decide well and then to control that the money was well spent as, let's say, the administration would like it to be spent. So it's an introduction to a very nice presentation by Professor Jan Segers and by our colleague Strachel Christoph, but it's also an invitation to do as many physical activities as possible for you, for your family, but also for the colleagues, because after COVID, we have seen that also the interaction between colleagues as it used to take place before has really lost a lot, and we have to restart to get the momentum, bring colleagues together and use it for our well-being, but also for socializing. I stop here and give the floor back to Rashida, who has so well organized this webinar. Thank you, Rashida, please.
Yes, thank you, Athanasios. I just welcome you. I'm very happy to have you, all the colleagues here today. And for this one, you don't know, I am Rashida Galoussi, staff representative, working closely with Athanasios and of course, Cristiano. And I am also the vice president of the joint committee COPAS, donc for social action. I just would like to say, very short, well-being at work is very important for Union Renouveau and Democracy. It's one of the key elements for us. And today we have invited Jan and also Strail, who explain us how physical activity is so important for our health, especially when you spend many hours sitting at our computer in front and doing no movement, nothing during a week. So this is very important to integrate some movement when you are seeing this conference, and maybe to stand up also. Do not hesitate to make some exercise. Jens will present us a very interesting presentation, Move More, Sit Less, Why and How. And after that, we will have our Strail, our colleague from DZIAC, who will explain sport in the EU for citizens, the community, and economy. I hope these two talks will inspire you to add more physical activity to your daily life. Enjoy the conference, and now the floor is yours. Yeah, thank you.
Okay. Thank you for the nice introduction. And first of all, thanks for the invitation and to be able to share my knowledge to your community. And I hope it can help you to organize more activities and to implement physical activity in your daily life. So I will now start sharing my screen and my presentation. So let's hope this works. So, okay. So as Rashida already mentioned, so the title of my presentation is Move More, Sit Less, Why and How. So I'm affiliated to the Department of Movement Sciences at the University of Leuven, not so far away from Brussels. So in my research activities, I'm dealing with how can we motivate people to move more and sit less. So that's why I'm invited to give this talk to you. So in my presentation, I will mainly focus on these three topics. So first of all, why is it important for our health? Perhaps most of you already know that it's good for your health, but I give some more background about this, and especially the second bullet is very important. How much physical activity is needed to improve and to boost your health? Because I know from experience that there is still a lot of misunderstanding about how much physical activity is needed, and I already heard a couple of times that you refer to sport and exercise. But I hope that you will learn from my presentation that it's perhaps not needed to do sport, but that implementing, integrating physical activity in your daily activities might be already enough. But I will explain this in the second bullet. And of course, the question is, how can we change our lifestyle? How can we become more physically active? And I will give you some insights about that. But first start why it is important to be physically active. And I will go back in history. And perhaps you already heard about this story, but I would like to refer to the London transport workers and how they changed the world of physical activity. And you might question yourself, what is the London transport system is dealing with physical activity? Well, it was in the 1950 that for the first time they investigated coronary heart disease, so cardiovascular heart disease, in two specific occupations. And as you might know, at the London Transport in the 50s, you had two occupations. You had the conductor and you had the driver. So the driver was sitting a lot of hours driving the bus, while the conductor was moving around in the bus, going to the second floor and back, checking the tickets. So, and what these researchers did, they followed up these two jobs over time, and they investigated, okay, what is the risk that these two types of occupations develop coronary heart disease? And perhaps what you might expect is that if you look at the chart, that the yellow bars are much higher than the pink bars, which means that the drivers were at a higher risk of developing coronary heart disease compared to the conductors. And one of the conclusions that these researchers made was, okay, the difference in risk might be related to the physical activity that they collect during their work hours. And this was really one of the first big studies showing the relationship between physical activity and health. And from that moment on, a lot of new research was developed and was published. So it's still 75 years that we have the evidence that there is a good link between physical activity and health. And nowadays, if we could create a movement pill which has all these health benefits, it would be really a miracle cure for us, and we could avoid a lot of diseases if we have this kind of pill. And in fact, we have this pill in our own hands because it's our behavior. So that's why it's still so important to incorporate physical activity in our daily life. And if you look at this infographic, if you look at the health benefits, it's clear that it's not only the physical health benefits, but also there is more and more evidence that physical activity also brings a lot of mental health benefits, even at the short term. On the immediate part of the benefits, you see, for instance, that there is a good relationship between physical activity and less anxiety, less depression. So there is also a very good link with mental health, not only physical health. And I also heard the importance of social health. So bringing people together, the social part related to physical activity is also very important. So I think the basic take-home message from these slides is that, okay, there is no doubt about the health benefits of physical activity, and it's not only health benefits in the long term, but also immediate health benefits at the physical, mental, and social part. If you want more information about all these health benefits and also looking at the economic benefits related to physical activity, I can refer to this very interesting report who was published last year by the WHO Europe together with the OECD. And they really calculated also what is the economic benefit of becoming more physically active. So because of the increase in life expectancy, in the prevention of premature deaths, it's clear that there can also be a lot of reduction in healthcare costs and in total health expenditure. So if we can promote physical activity within the population, we can really help also the economy, and the European economy will benefit from a more active society. But the question that we have to ask ourselves, how much physical activity is needed to boost our health? And to explain this, this volume of physical activity that you need, I will use the FIT principle. And the FIT principle refers to frequency, intensity, time, and type. So if you look at the physical activity recommendation, you can ask yourself, how often do I have to be physically active? at what intensity, how hard do I need to work to do this activity, how long, and are there also specific types of physical activity who are more beneficial than others. And of course, also here, we are guided by the WHO, the World Health Organization, who updated their guidelines a couple of years ago. In November 2020, they published for different target groups, for children up to older adults, what is the recommendation for physical activity, but also a recommendation on sedentary behavior. Because, as mentioned before, we are sitting for a lot of hours, and perhaps I can invite you, if you're now sitting, please stand up and follow the presentation while standing behind your desk for the next part of my presentation. And if you look at the guidelines, and I will mainly focus on the guidelines for adults and older adults, you can see here a number of minutes that should be accumulated during the week. If we look at the children, so if you look at the right part, we see that our children need 60 minutes of physical activity every day. If you compare that with the recommendations for adults and older adults, it's a recommendation on a weekly basis. And it shows that we need 150 minutes of moderate intensity physical activity or 75 minutes a week of vigorous physical activity. And I will explain in a minute what is the difference between moderate and vigorous intensity. But as you can see, as an adult, the recommendation is defined on a weekly basis. So this gives the advantage as an adult to schedule your activity over the week. So you don't need to do the activity every day, although it's recommended to really spread it during the week. But even if you don't have the time to do a specific activity on a specific day, it's not a big problem because you can accumulate it over the other days in the week. But also very important, it's not only aerobic activities, but also we should perform a couple of times per week some muscle strengthening activities, because as we age, we lose our muscle mass and we lose our muscle strength. So that's also very important that we combine aerobic and muscle strengthening physical activity during the week. Coming back to the intensity. So what is moderate and vigorous intensity? Because I often receive this question when I'll talk about the recommendations. And I always refer to the talk test. So if you do a specific activity, and if this activity is at a moderate intensity level, you can still talk during that activity, but not sing during the activity. So it increases your breathing, it increases your heart rate, but you're not out of breath. So then you're still doing activity at a moderate level. And I give you some examples like walking very brisk, 5 kilometers an hour. That's already an activity of moderate intensity. And if you take these kind of activities and you do these kind of activities for 2.5 hours a week, then you're meeting the recommendations. If you like to do more vigorous intensity activity, that's an activity where, of course, your heart rate will increase more and your breathing will increase. So you need some pausing for a breath during that activity. And here you see a couple of examples of activities that you can do at the vigorous intensity level. Well, the good news is if you like more vigorous types of physical activity, you need less amount of time to do these kind of activities over the week. So you can play with the frequency, with the intensity and the time to meet the recommendation. So this gives you a lot of autonomy about how to fulfill the recommendation over the week. And as you can see, the examples, it's not only sport activities, but also walking and cycling for transport, for instance, can be included as part of the recommendation. To just give you an idea how physically active is the world, or how physically inactive is the world, and if we look at our children and adolescents, we really have a problem. And we still need a lot of work to promote physical activity in our children and adolescents. And the health behavior in school-age children is a very nice survey which is conducted every 3 to 4 years, so you can see really the trends in this kind of figures. But the bottom line and the main take-home message from these kind of surveys is that the proportion of children and adolescents who are meeting the guideline, and as you remember perhaps that the guideline is 60 minutes of physical activity every day, then this proportion is very low. Only 1 in 4 of our boys and 1 in 7 of our girls are meeting the guidelines globally within all the countries surveyed within the health behavior in school-age children. If we look at adults, well, the picture is a little bit better, although we know that the recommendation is less. So it's a recommendation on weekly basis, and this is a very recent publication from 2024, and it was based on numbers collected in 2022 on the world map. And of course, you see a lot of red areas or red countries, which means that these are countries where the prevalence of adults who are insufficiently physically active is over 40 or 50%, but globally we are around 30%, which means that still 1 in 3 adults are not meeting the physical activity recommendation. So that's why it's important that still are at policy level, that there are a lot of actions and policies who wants to promote physical activity at the population level. But next to physical activity, we also have our champion in European sitting. So the European Sitting Championship gives us some numbers about the hours of sitting on a daily basis. And you see here the results of the most recent Eurobarometer, where you can see the different countries and the proportion of adults who are sitting in different sitting categories. And here about 30% of these adults are sitting between 5 hours of 30 minutes and 8 hours of 30 minutes. Of course, it takes all adults and all different kinds of occupations and jobs into account. But if you look at perhaps your own job, and I suppose that most of you are office workers, well, we know in office workers that most of them are spending 50%, 57% of their time sitting. So it's really a sitting marathon, and which is also becoming more and more problematic over the years. And we also referred to the COVID pandemic, where we see also during the COVID pandemic that we see that the number of sitting hours increased as well. And why is the sitting so important, or why is the sitting a risk factor? Because there is some research showing that if you sit a high number of hours, that this cannot be compensated fully by being active. So we refer to this phenomena as active couch fatigue. So sometimes I receive the comment, yeah, but I go for a walk over lunchtime for 30 minutes. So it's okay that I sit then for 7 or 8 hours if I do that activity over lunchtime. I say, okay, it's good that you have this activity over lunchtime, but sitting for 8 hours next to these 30 minutes of walking, well, the benefits that you gain from your walking will be, a little bit diminished by the high number of sitting. And this was shown in a very interesting study where they compared 2 different groups. We have the inactive people and the active people. So the inactive people, they were not meeting the physical activity recommendation. And you see on the graph, the higher percentage of time they spent sitting, that the risk to have for all-cause mortality, I can say most of our research that we do, we look at very dramatic outcomes. In this time, it's mortality, but that's what we do in epidemiology. But in the inactive people, you see a clear increased risk when they spend more time sitting. But even in the active people that you see on the right side, the green bars, even in these people who spend some time during the week on physical activity, if they sit for 75% or more during the rest of the day, they also have an increased risk of all-cause mortality. So the take-home message from this study was that even you do the activity over lunchtime, it's still needed to decrease the number of sitting hours or to interrupt your sitting time as much as possible. And that's why in the current recommendations, they implemented this kind of figure that you should balance your sedentary time with your physical activity time in a good way. So you have to really interrupt your sitting time as much as possible. And in addition, try to incorporate some physical activity sessions during the week. So it's not sitting or activity, it's less sitting and more activity. So it comes to the question, why are some people physically active and others not? So how can we change our lifestyle? So if you know now what is the recommendation, and if you look at yourself, are you meeting this recommendation? Well, what can you do to change your lifestyle? And to answer this question, we use a specific model related to behavioral change. And the model that we use in our research is the social ecological model of determinants of physical activity. And this model uses different levels of determinants of physical activity. And it's represented by this figure. And you can start at the individual level, then you go to the social level, to the physical environmental level, as well as to the policy level. This figure shows that if we want to change our behavior, the individual is not enough. So I can give you some more knowledge about the importance of physical activity. I give you some knowledge about the recommendations, but this will not be enough to really change your behavior. You will also need a surrounding environment at social and physical level that really supports your physical activity. But first start at the individual level. So if we look at the individual at the personal level, we know that an important determinant of physical activity is also about your belief and your motivation. And looking again to the Eurobarometer and the top 5 main reasons that people give why they are currently not practicing sport more regularly, of course, not having time is the most frequently answered thing, but also a lack of motivation or not interest. So 25% also say, okay, I lack the motivation or I'm not interested. If you look at our research, we know that a lot of people have good intentions to become more physically active. And we are now reaching the end of the year 2024, and we know at the beginning of a new year that a lot of people are making good resolutions in terms of becoming more physically active. But we know there is a big gap between these good intentions and really, translating these intentions into real actions. So there is an intention behavior gap. And one of the problems is that most of the time our resolutions are too broad or too general. You say to yourself, okay, I want to become more active. But this is very generic, very general. So we need more specific goals to really bridge the gap between your intention and your behavior. And what can help in bridging that gap is to make a physical activity plan. And that is also something we use with our students, that we learn them how to develop a physical activity plan. So that's also what you can do to increase your level of physical activity. You can question yourself, okay, what activity I would like to do? Where would I like to do that physical activity and when? So that's the action planning part of the physical activity plan. So it gives you really concrete goals or concrete information about your physical activity. But then it's also very important to develop a coping plan, which means that you should identify already some barriers for you which might hinder the completion of this physical activity plan. Which means that, for instance, if you lack the time, or if you have a busy schedule, or you don't like to go out when it's raining, it's very important that you identify this barrier, but that you already find a good solution and a strategy to solve this barrier, so that you already have the solution in your mind when you are faced with your barrier. But even with such a physical activity plan and with good intentions, we know from the socio-ecological model that it's not enough. We also need, at the next level, social support. We also need family, friends, and colleagues at work who supports our physical activity plan. If the physical activity plan is not supported by your family, well, it will not be easy to execute your physical activity plan. If you say, okay, I go out for a walk in the evening, and if your partner is saying, oh, why are you going out? I'm not supporting that. Well, it's very difficult then to do that activity. And it's also important, of course, at work that there are some cultural norms and practices. If you want to stand up behind your desk and walk around a bit in the office, but all your colleagues are looking at you and saying, okay, why is he or she not sitting behind his desk? Well, then it's also not a norm within your environment to really stimulate these kind of behaviors. Going to the next level, it's the environment. So we also need social environment, which is closely linked to the social support, but also the built environment. If we have green areas, parks and recreation facilities next to our home or next to our office, we know that the likelihood to be more active is much higher than if the built environment is not that active, let's say. Also, natural environment is very. So you know, of course, if you move up into the socio-ecological model, that your own impact is, of course, not so high. You have a high impact on your own individual factors and interpersonal levels. But of course, the environment, you depend sometimes on the policy and on the community. Where do you live? And that's why the next level is also very important. It's the regional and national policy that's in place. And there I refer to a very recent report that was again published by the WHO, who looked within the European Union, all the different countries. They had to list and reflect on all their policies that they make to promote health enhancing physical activity in their country. So if you're interested in what is your country doing in terms of the promotion of health enhancing physical activity, I can refer to this report and you can read about the plans and the activities that are taken at the policy. But policy environment are very crucial also to really promote physical activity at the community level. So it's not only up to you, of course, that's the starting point. You have to perform or you should perform a certain behavior, or you have to behave in a specific way. But we know now from research that also your social environment, your built environment, and the policy level are needed to really get the actions into play. So this concludes my presentation of today. So the take-home message from me is try to interrupt your sitting as much as possible during the day, and try to incorporate at least 30 minutes per day of moderate intensity physical activity. By doing so, you will not only improve your own health, but also the health and the economy of the whole society. Thank you very much.
Thank you so much, Jan.
So I hope you're still standing behind your desk or not.
Yeah, you will. And you
again.
do.
You can sit down again, no worries, no worries.
Yeah. It's very interesting. Thank you so much. And I just see a question here in the chat about a colleague. She put it in French. It's about not for the administration, because you make always speaking about the work at risk and with penability, but never speaking about administration, because as I did in my presentation, in the administration, and you told in the presentation, we are sitting 8 hours a day, 5 days a week. And it's true. It's very dangerous for the health. And just to have a point of view for you, Jan, about that.
Yeah, that's true. So that's why I said it's a combination of both. So it's not only about the promotion of physical activity and doing sports activities, but it's indeed also during the day trying to interrupt your sitting time as much as possible by standing up regularly, but also walking around at the office. It's also very beneficial. So it's really the balance between your sitting time and lighter forms of physical activity. And in addition, trying to schedule some more intense physical activities during the week, which is the take-home message that I want to give. But be careful, also standing a full day is also a health risk. So it's not that you replace your sitting fully with standing. No, it's really the balance and really changing your posture and changing your behavior, because I think the bottom line is every behavior that is prolonged for a long time, it's not good for your health. So we have to really change as much as possible, and it's during the day really balancing also the sitting and standing. So that's really, but it's really a combination of both. So it's not that you sit 8 hours, which you can compensate by going out for a run for 30 minutes. No, then you're still at risk because you're sitting these 8 hours.
Thank you. Athanasios?
Well, I don't have a specific question. I think that the presentation is really extremely interesting, because you combine, of course, simple things with net effects. So sometimes, we are so happy when we have a lot of things to do, and we have worked hard during the day to finish a report, to finish what we have to do, and then at the end of the day we have also satisfaction because we achieved it. And what we do is that we go directly for a beer in the pub next to the office and continue sitting, and adding also some other bad things on our habits. But of course, how it works with me when I get a new gadget, allow me the term, so a new watch that monitors how much I have run, how much I have been sitting, standing up, etc. It helps me boost my physical activities during the first weeks that I have it. And then maybe I will start sitting again more, or I will convince myself that I have to finish deliver all the things I have to do. I don't know if there is any research which shows that climate is not the problem. So countries that have a lot of rain do not really have people who don't do any outdoor sports. countries where you have a lot of snow, like for example in the north of Norway, where I had the chance to live for 2 years, I realized that people are doing much more sports than in Greece, where we have a lot of sun during the year. So indeed, the environment plays a role, but I think it's more the mentality, what friends are doing, what the state does for you. Also, I like a lot what you mentioned about the green part, the bicycle roads, what the society does for you, and this can stimulate people to do things together. And also, I have to say that while listening to the presentation, I remembered of the first period during the first COVID that I was going walking and participating at meetings that we were doing from the mobile phone at that time. We could not go to the office. And I felt really a very positive effect. Unfortunately, now if we restart doing this, we may be seen by some colleagues that we are out walking and not doing anything. So we have to find the right equilibrium in order to do things, motivate colleagues, make colleagues move ourselves, and yes, try to achieve that one helps the other, but we still need to find the correct ways. I believe that Rashida, when we have exchanges with DGHR and especially with Directorate D, where they work on things like fit at work, well-being, etc., to share the slides of Jan, and of course make Jan available for a similar talk also with administration, in order to try to find ways like small gyms or like small indoor bikes in every building where people can go and have some walking. Or, you know, also this, now I see it a lot, like this standing, or I don't know, this cyclette where you can exercise indoors, but at the same time also generate energy or this kind of things in order to make it, to charge your mobile phone and things like that. What to say, extremely interesting presentation. Thank you so much. And of course, back to you, Rashida. And there are so many things written. So Jan will get also, if there are questions in the chat, you will get them to respond. In the meantime, I have taken these two things to make also some more intensive exercise.
That's your muscle strengthening activity.
Exactly. So trying to achieve the most.
No. So, but indeed, the questions in the chat can send to me afterwards as well, and I can respond to them as well. Okay. But also, I see a lot of reference to standing desks. Of course, this is in the environment something you can provide people with. But we also know from research, if you provide a standing desk, that a lot of people are not using them, because also there the cultural norm within the office, if standing is not well perceived, or if you are not feeling comfortable with standing, then sometimes the implementation is not. So you need also a very good policy around it, and also, as I explained, you should not replace 8 hours of sitting with 8 hours of standing. That's also not the solution. So it's really the balance and the equilibrium, like you mentioned, that we should strive for.
Thank you, Jan. There is a lot of question here. What I propose is maybe colleague continue to put the question in the chat, and after that I will share this question with Jan, and we'll have the answer in our site, like that all colleagues have a chance to ask a question and to give the answer by Jan. Jan, thank you very much, and stay with us, because now we have a presentation with Strail, our colleague from Unit D Sport, to have some element regarding the program put in place and recommendation for the member state. Strail, the floor.
Thank you, Rashida. Hello to everybody.
Yours.
Thank you very much, Jan, for your very interesting and insightful presentation. And now, after Jan's introduction on the science behind it, I'll talk to you more about the policy on what we do at EU level with the member states on policies related to getting the population to be more physically active. So the presentation is not on everything that the sport unit does, but it focuses more on the topic of today's presentation, although I will give you an overview more or less of what we do in the commission without going into too much detail in the other fields. So I'll just share the presentation with you now. Does everybody see it?
Not yet.
Not yet.
Because normally you should be able to see it now. Yeah.
Yes.
Okay.
It's coming now.
Okay. So yeah, the title of the presentation, like Jan mentioned in that step-up report by the OECD and the WHO, which in fact is co-financed by the European Commission because we have a partnership with the WHO, and there is a grant which they use. They're the scientists, of course, and they use this grant to develop studies. One punchline that one could say is invest.
Excuse me, Israel. Now the presentation is black. We try again. Sorry for that.
Do
Voilà.
you see the
It's
slides
okay.
changing?
Yes. Yeah. Now it's okay. Now it's okay. Yes. Thank you.
Okay. Okay. Yeah, this is just the introductory screen, and it was just to say that one punchline I heard recently was which has to do with what this report that Jan showed, the step-up report. Invest €1 in health, save €5 on health. Invest €1 in sport, sorry, save €5 in healthcare. And this is for the system, because if you invest €1 in the population to do more sport, you would save a lot on hospital bills, not only for people dying, but also the state of people. This sitting that Jan was talking about and that everybody was talking about before that, it was also the main central point of the presentation of the health ambassador in the Paris Olympics. For the first time in the Paris Olympics this year, there was a health ambassador who made the link between sport and health, and he said that sitting is an epidemic. And he went on a presentation that I participated in, and I had the chance to watch. Basically, he was explaining how a lot of back problems, for example, come from this prolonged sitting. And these back problems then prevent people from doing sport. It makes people go to the hospital very often, go to the kine. So, you could even say invest a minute in sport and save 5 minutes in healthcare, just like the euro, the same analogy. But okay, onto the topic, because I'll try to finish in 10 minutes so that we can discuss afterwards for 20-30 minutes, because I see that indeed there are a lot of questions, and I'm sure that everybody would like to get some additional insights from Jan, and I'm open to answering any questions also, of course. So to provide a situation on a picture on the situation in Europe, we conduct a special survey on physical activity under the Eurobarometer every 4 years.
Yeah, Jan, sorry to interrupt you. It's black now again. I don't know what's happening.
I don't know why that's happening on my screen. Yeah, now do you see it?
No, it's still black.
Strange.
Yes, it's strange because before it's.
When we did the test, everything was fine. Yeah.
Yeah.
Is it still black?
Maybe connection problem. No, it's still black. Yes, trial.
Okay.
Sorry, colleague, for this technical issue, but it will be solved because maybe not share and share again.
Yeah, that's what I'll do.
Yes, now it's okay.
No, now it's okay?
Yes. Voilà, now it's okay, yes.
Okay, so now you see the slides?
Yes, I see, yeah.
Okay, so the picture that you see is the Eurobarometer, which takes place every 4 years. It's a special Eurobarometer on sport, a survey basically carried out in every member state with the sample size, which is not always ideal because 1,000 people may be okay for Malta, but maybe it's not okay for Germany, which is a country of more than 80 million. So it's a more or less representative picture, but it's not ideal, of course. And what it shows you here, this question, how often do you exercise or play sport, is that almost half of Europeans say never. And this is rather alarming. You saw the figures on a more international scale from Ian's presentation, and it does show that there are a lot of people who never really practice sport or more rigorous physical activity, even moderate physical activity. So there is a lot of work to be done by policymakers on national, regional, local level, and by society to improve the situation. So this is to give you a picture of where people say that they practice sport most of the time, and most respondents point to outdoors and parks, which is exactly why it's important to have a good environment, as was shown in Jan's presentation earlier. Now, the numbers don't add to 100 here, they add to more than 100 because some people practice sport in parks, but also at home or also at the gym. This just shows people's preferences. At home is quite popular, but this has probably gone down now because the survey was carried out during the coronavirus when there were a lot of limitations. And a lot of people tried to combine it on the way to home or to work, school. Basically, this is a form of physical activity where, for example, mobility is being promoted, like cycling is very good because cycling allows you to get from A to B, even if you're going there to a specific destination, but you're also doing sport by cycling. So this is something which is a win-win situation, for example, when it comes to urban planning. And the motivations for engaging in physical activity here, you really see the link with health, where most people say that they do it for health. Others is to just be in better shape or to look better, to relax and to have fun for recreational reasons. You see the reasons. These slides will be shared with you, so there's no need to go through all the text. You have the time afterwards to go through it, and there's a link at the end on the website where you can find even more details. And what is preventing you? This was already shown in the presentation. Now, this argument, I don't have time, I don't really buy it. It's not really a strong argument. It's a question of priorities, rather. It's not a priority. That's how I interpret I don't have time. But indeed, lack of motivation and of interest. This was already shown in Jan's presentation, so I'll move on. And this is something to basically highlight that there is, which was also shown earlier, there is a gender balance issue when it comes to sport. For example, and also generational. For example, often children practice a lot of sport and are very physically active until the age of 13. And afterwards, because they get more studies, exams, and so on, they stop. Also, it's got to do with gender. For girls, it goes down even less because afterwards, with puberty, it's more difficult for them for physiological reasons and biological reasons, you could say. There is for women after they give birth, for example, after 35, almost no women, like the results of physical activity in women after 35 are extremely low all over the EU. So this is something to be addressed, especially when it comes to the environment that was mentioned earlier. For women, it's very important to have a safe environment when going jogging in the evening, for example, which is also important for men, but even more important for women, which is another reason why a lot of women are put off by, for example, jogging in the evenings. So this is something to consider, and we do work on gender balance in the sport unit, not only also for professional sport, but beyond professional sport too, for grassroots sport. So as a policy, the sport unit in the European Commission was created a bit more than 10 years ago. So it's in the Lisbon Treaty. And there is an article that mentions the importance of sport, and this is the basis on which the sport unit was created in the European Commission in order to address specifically the needs for promoting sport in society. And every 3 years we have a work plan which shows you what the priorities are and the main objectives, and it carries on in a progressive, progressive way, keeping the main objectives every 3 years more or less in line with the previous years, but some of them sometimes change to better reflect the needs of the times. And at the moment, the priorities, they were the same actually in the previous 3 years. The titles are kept the same, but some details have changed. Remain integrity and values in sport, which speaks a lot about professional sport, but also giving an example to to grassroots level sport, anti-doping, for example, no match fixing, gender equality that was mentioned. Then there's the socio-economic and sustainability dimension of sport. So imagine major sport events when you organize a big football match with 50,000 people. That has massive implications on the sustainability, not using plastic cups. What kind of transport do you use to get there? So there's a big footprint, especially on major sport events, but not only so, sustainability is definitely important in sport. And then there is participation in sport and health enhancing physical activity, which I'll go into in a bit more detail. Now, there are different actions, cooperation with the Council and the European Parliament. We promote a lot of exchanges of good practices and awareness raising. This is also done by the Erasmus Plus, for which we have funding available for sport actions, which I'll show you a bit later. And we also promote events, organize events, but also promote member states to organize events and campaigns for promoting sport and getting the population to be more active. The European sport model was created in order to really emphasize this importance of how the grassroots is the most important, basically amateur level sport, because this is how you create top athletes. You need to have a lot of people, or the more people you have doing sport, the higher chances you'll have that some of them will become very good at sport. But then the idea is that the top of the pyramid gives back to the grassroots level. So there should be reinvestment in order to stimulate more grassroots level sport. It's good for the health, but it's also good for achieving greater sporting performances. So there is a lot more to it than the European sport model, but I will skip because that's not the main point of the presentation. Now, this health enhancing physical activity that was mentioned in Jan's report, the report that came out in 2024. This is basically built on a council recommendation. It's the only council recommendation in sport policy, because we don't have regulations and we don't have directives in sport policy, but we have this council recommendation on supporting member states to promote physical activity. And based on this, we established a partnership with the World Health Organization, where together we monitor member states on 23 indicators with that, for example, ask them, do you have recommendations on physical activity in your member state? Do you measure the levels of physical activity in adults? Do you measure the levels of physical activity in children and adolescents? Do you have surveillance mechanisms? Do you have training for health professionals? So there are 23 questions which basically invite member states, if they do not have these mechanisms in place, to start practicing them, because the idea is that this way it should help to increase physical activity in the population. And the latest report that Jan referred to is indeed published by the WHO, and you can see the overall report as well as the country fact sheets. And the positive trend is that from an achievement of 65% in 2015, when we started this, now we've reached 82% in implementation based on this latest report that came out. So member states from 65 moved to achieving 82% of the indicators, which shows an improvement. Now, since this recommendation has been in place for more than 10 years, we're working on renewing the recommendation, and over the next year, we will be reviewing the recommendation with the idea of adopting a new one around 26, 27. And by the way, this is also when we plan to publish a new Eurobarometer survey in order to show what the trends are. So as was mentioned earlier, we don't have directives and regulations. We have soft policies, but also funding available. It's not as impressive as the structural funds, for example, which is in the billions and the dozens of billions, but it's about 2% of the Erasmus Plus budget, amounting to almost €500 million for the period 21 for the multi-annual financial framework of 21 to 27. And it covers all three key actions of Erasmus Plus, including mobility of sports staff, including coaches, so exchanges of practices between coaches from different member states, cooperation, partnerships, and support to policy development. There are 5 examples now of some successful initiatives organized, and we'll finish the presentation so we can have a discussion. One is the European Week of Sport, which has existed for almost 10 years, and it basically invites all member states to organize sporting events, especially in the last week of September. And you have thousands and thousands of participants all over Europe, really, like in the tens of thousands, that participate in various events organized nationally, regionally, locally. I mean, really in all member states. So this has been going on, and it really helps to motivate some people to get into it, and maybe it has a lasting impact on some, which is an achievement. The Eurosport Forum is organized every year. This is more to invite member state representatives from ministries and agencies to exchange good practices. But we also have Olympic ambassadors who come and visit in order to inspire and deliver some presentations. There is also a Sport Info Day. It's actually in 2 weeks, where organizations from sport, different clubs, associations, NGOs working in sport are invited to come and get more information about funding opportunities from Erasmus+. There were also the Be Active Awards and the Be Inclusive Awards, which are basically awards in different categories for organizations and individuals that have done good practices in sport. And there is an award of 10,000 euros, but also the recognition at an EU level with an event, with a gala dinner, where they get to meet the commissioner and other high-standing officials. And this basically promotes people to put more emphasis on good practices in sport. My contact details are here, and this is the sport website. Thank you very much for your attention, and I remain available to answer any questions now or in writing later. Thank you.
Thank you so much, Strail. Thank you for the very interesting presentation, and also, like Jan, very practical to understand the different element and initiative taken in Europe. It's very interesting. I don't know if there is a question for you. I just see in the slide, in the chat, there is invest €1 in a sport, save €5 in the healthcare. So you can all trade union together going to ask here the reimbursement of the fees to our security, and this is also nice. But there is an answer also about that. About there is some alliance or Sigma apparently reimburse the fees of the fitness club. This is very interesting to investigate more. I don't know if there is a question, because I didn't see it in the chat, but colleague, be free to write the question, and I will share with Strail in order to have the answer.
If I can say something about
Yes.
the activities of COPAS that we mentioned at the beginning. So COPAS is the joint committee for social actions. I think the Commission can do much more during COPAS for, especially here we are talking, I mean, I'm the president of the Central Staff Committee, so not just Brussels. We have so big unfairness on the distribution of funds between the various sides that it is extremely impressive that in some places of employment, and in particular when it comes to the capitals of the European cities where we have our colleagues in representation, the European Commission doesn't even allocate €500 for the entire for the staff in the representation for all the social actions, so practically nothing. At the same time, there are places like Ispra, where I come from, where we have hundreds of thousands for the clubs of tennis, of volleyball. And the thing is that what we can do as trade unions, as a staff committee, is to insist that the Commission puts this money where the need exists in order to boost something, and then not necessarily give them every year. So I think that instead of asking that the fund, which is a health fund, pays for the subscription of a gym, they should make sure that there is something in every building, for example, or that if somebody demonstrates that instead of taking, is maybe a stupid example, But someone who commutes at the office and has to spend 45 minutes in the train in the morning and then another 45 minutes sitting on the train to return, maybe by demonstrating that at least twice per week this person goes out for a walk or in some way may have an even more flexible way of working or things like that. It's difficult to ask that the Commission pays for our registration to a gym, but we can ask that specific things be put into our availability in the buildings. I see that Strahil would like to react or to say something else.
Yes, thank you. Just to mention, Athanasios, that from my understanding, there will be a session in January, maybe. I'm not sure if Rashida mentioned it.
For leisure
clubs,
focusing... certainly the leisures, yes.
Yeah, that will focus more on the internal parts, and we cannot really provide insight on this. I mean, I don't work on this, neither does Jan. But what we can do is obviously to talk about different incentive measures that could exist, that could be done. I know that in Belgium it does exist from the mutualités, from the insurance schemes, basically, that they do subsidize parts for attending the fitness clubs, sport clubs. It's not ideal, of course, because they don't subsidize everything. This is definitely sometimes it's definitely a factor, because what studies show is the socioeconomic background of people does have a direct relationship with how much sport they do. Basically, people who are in material difficulty have less time or just less means to practice sport and physical activity. So indeed, there can be initiatives in this direction, but obviously it's a very complex model, like Jan presented, where it's really the individual, the personal, the social, the environment. It's a complex approach, but maybe we can address some from the questions from the chat.
Absolutely. Jan?
Yeah, well, indeed, it's a complex model, but there's more and more evidence that really the environment which we can create also at work is really stimulating, and it's not always a big cost that you need to really stimulate the activities at work. I also saw the suggestion to, okay, do we need to install a gym in every building? That could be a huge cost. It can help for a number of people, of course, but if we look back to the physical activity recommendation, going to the gym is only one solution to meet the physical activity recommendation. Even promoting active transport, for instance, how do you commute to your work? How do you facilitate that? And I can refer to the KU Leuven, to our university. We have a very good bike renting scheme, for instance, or even they offer free bikes to the employees because they discovered that a lot of employees were living just in an area of 20 kilometers around Leuven. So these kind of measures also, these kind of things can also help to improve the physical activity of the employees. So that's just one suggestion, but just think broadly, but know that indeed you were right, Anastasios, that the environment is very important. As well. And even the social environment, how do you support being a colleague, is also very, very interesting. And also there can be some incentives.
And of course, there is another thing that is very important, is the information. So now you mentioned, for example, the bike sharing scheme. I am a partner of various of these schemes. For example, I use Velo, these bicycles that in Brussels you can rent. One of the things that I find at the moment that I need to go from one building to the other, my big question is always, where will I find to leave the bike if I'm late? And so, of course, by using, I realized that in almost all Commission buildings, very close, there is a parking lot. how much does it cost to use Velo? It's 3.5 euros per month. And then if you do it up to 30 minutes, it's for free. So it would be enough, for example, for the commission to try to collaborate with one of these companies and make sure that there is a parking lot, even for few bikes, in front of every building. That is one thing. Then I heard from a colleague recently that the council has a very nice gym that even people from the commission can use, but nobody knew. There are other buildings where there are some, so even spreading the information, trying to, and this is something that through COPAS, and we have to take this message, Rashida, and try to inform colleagues that some possibilities exist. Let's try to use this first and then go for the next level.
Yes, if I may, Athanasios, yes, in the COPAS there is this program, c'est Be Well at Work. On the share drive, you can find all initiative because the colleague put initiative and run initiative from a voluntary basis every week and try, because the difficulty, Jan, it's also we are in the office only 2 days a week in general, but we can have up to 3 days, and to find the way to have a colleague present to do this activity. What I can add also about the incentive, I know the institution pay the reimbursement of the transport, not all, but half part of the transport, to try to tell the colleague, take the transport, the public transport, come take the bicycle, because there is also some kind of policy about the bicycle. Is not a lot, sure, is not a lot, is never enough, but at least little by little the mentality try to change. This I would like to add also.
I have to tell you that I tried to use this scheme for the bicycle, and I said that why I want to use this? In order to have reduced parking possibilities so that I don't go by car.
Yeah.
I didn't find how to do it.
Yeah,
And
the communication.
It's theoretically speaking 100 euros per year in order to get accessories for your bike or a new bike. I didn't manage. So yes. I think that it is the information equally important as the active support by doing things, by giving a gym, or now, of course, there is a comment about commissioners and bodyguards who can use the gym. Evan, who has asked for the floor.
Yes, thank you very, very much. I just wanted to bring to your attention that actually the council, the general secretariat of the council, is subsidizing a lot and supporting a lot of sports activities. And one of those is a club for shooting, for target shooting. Now, this club is called Eurogun. It accepts members from all institutions. And I still am a member of that club. But for example, due to the limited resources that they have, as none of the other institutions are supporting this club, the club is downsizing. And we have asked to basically leave. Everybody who is not actually actively working in the GSC has to now leave and find a different club to actually carry on with these sports activities. I'm afraid that the European Commission is not so much supporting sports activities like this, or sports activities in general. Perhaps a solution should be found so that a joint venture could perhaps take place among the EU institutions, so that we can all benefit. So I don't know, just a thought, and it's a coincidence that I received the news that I have to get out of that club because I'm working for the Commission only last week. So please, your thoughts about that. Thank you.
Well, if I can react immediately, I think synergies between the institutions is the best thing that we can do, as we do in many other things. Sometimes we are very heavy and not flexible and mobile enough to talk to each other and organize things together. It's a good idea, and we will
Yeah.
have to see with our counterparts in the Council and Parliament what initiatives to achieve together, and what we were doing a lot in ISPRA, for example, and is done also here, but maybe not as much, is to go and see if, as a trade union, we can also achieve better rates in gyms or in shooting clubs or in all other types of clubs, in order to somehow motivate colleagues to go. It's like an indirect, of course, publicity, advertisement, but sometimes it can be done.
Yeah, Atta, if I may, for
Yeah,
the
of course.
leisure club, but Giorgio, I think, is with us, is the president of this leisure club in the commission. It's 48 club, I think, more or less. And in the club, there is, yes, there is a colleague from the parliament, from the council, and from the commission, and also a external person for the club. There is already this cooperation in the leisure club already in the commission. Just to give an example to Evan, maybe you can contact me and we can see also to make you in contact with the different club already existing and how they put the different membership from the different institution. This we can investigate a little bit, Evan.
I believe that at this stage, the most important thing for us is to pass the message of what Jan and Strahil presented.
Yes,
so that people are aware of themselves. I mean, we have to be self-motivated on this aspect. We cannot wait for the Commission or the other institutions or other colleagues to come and make us move. If you are not, if you don't have self-motivation here, you will never do it. Of course.
But yeah, but what you said, Atta, is true. If you have also to make more publicity, more information like that, you can inform what existing already to the colleague. This also another action.
Absolutely, absolutely. And the clubs and the grouping is important because then you learn by the others. You learn that there is, for example, a very nice cycling path which leads you, for example, may lead you to Charleroi. It can be a very nice excursion, etc. And you start and you do it. Cycling 50, 60 or 70 kilometers, whereas on your own you might not even start. And the same can be with all other sports. I think it's sharing the information can, of course, boost. Informing people about the benefits and about the risk that exists with both sides. As of course also Jan said, we shouldn't try to substitute sitting with standing. There should always be a measure on everything. Yet we are an institution that it's also an evidence-based institution. So all this kind of information, the scientific thing, the fact that the example of the driver and the conductor was really a very good one, even though in Greece maybe the conductor would be more in risk for his life because he would be attacked by the client. Allow me this joke because it happens every now and then, but indeed somebody who is only sitting and someone who is moving, this is a very, very clear example, even several decades ago, of how two people who breathe the same air, are in the same place, can have such a different fate. Strahil, please.
Thanks, Athanasios. Athanasios, sorry. There are some software solutions also available that exist in some companies, which is completely feasible, that make you get up. If you've been working for 30 minutes, for example, it tells you, okay, now go and take a 5-minute walk, go make a coffee, whatever, go to the toilet. And then you can bypass it, but after like the third time, you cannot even bypass it. The screen freezes, and then you really have to get up and do something. So, these simple solutions can actually help you to break these long-lasting episodes of either sitting or...
Have it here. It has told me to...
Yeah. Yes, Jan.
Yeah. This relates also to a comment in the chat about, okay, but sometimes you have a deadline to get, and you're so busy, and indeed reminders does not always work. I think there is not a one-size-fits-all approach, and I think you have to find a solution which works for you. If you need a reminder, then it can help to install that kind of software, or indeed you have a smartwatch but don't, because there is currently no scientific evidence on, okay, what's the on the interruption of sitting in terms of duration. So that's not, okay, we sometimes use the practical rule of thumb that you should change your posture every 30 minutes, but it's not, at this moment, the scientific basis is not so large. So the main question is just try to, change this as much as possible. So, and if you sit for 2 hours at some occasion, so don't feel too bad about it, but just be aware that, okay, perhaps in the next hour or the next 2 hours, I have to move a little bit more, or I have to compensate this a little bit more. But if it becomes too regularly that you sit for many hours in one occasion, then you should increase awareness about that. But don't feel too bad if you sit for a couple of hours because you have to do it, because you have to meet the deadline. So don't feel too bad about it. And that was a little bit unlucky with the first research on sitting, that sitting is the new smoking, and okay, it was very dangerous. Okay, let's calm down. And we know it's a matter of balance. Try to incorporate the physical activities over the day. Try to balance your sitting and standing and walking as much as possible. Don't feel too bad if you sit at one occasion 2 hours. So don't be, so that's because otherwise you feel guilty, and then it's also not good. So try to find the right balance and find a reminder solution, or instead of asking a colleague to get a cup of coffee, just go by yourself. So don't ask a colleague, okay, do I need to bring a cup of coffee? No, just ask them, okay, join me to get a coffee. So these are small things which already can help in changing your habits.
But Jan, you said that sitting is the new smoking, or not sitting is not the new smoking. Definitely, smokers never sit for 2 hours without going for a. Anyway, just to mention something else, one of the previous webinars we had as R&D was a discussion with the Cancer Support Group, and the presentation was by a group called Outdoors Against Cancer, and the whole idea was that if exactly you do the same things, so you walk, you exercise, you try to be fit, you try to of course, be at work, but also at the same time continue a normal life, has tremendous benefits also from that point of view, and in order to recover and to survive even a very maladie grave, a very heavy sickness. So this is yet the second presentation where we see all the benefits of being active, of doing some sports, of not staying idle, of trying to combine things for our for health prevention, for let's say prevention and improvement of our health, but also as a therapy for some kind of other situations. So I think that by now we have 2 out of 2. We have quite also some evidence to ask HRD to maybe consider, instead of publishing the program in these pieces of be well, fit at work, etc., but just to like we had during COVID, how to wash our hand. Please remember to take the stairs. Please remember to stand up. Please remember to do things yourself. Walk to the office, do things. If there is something that you don't know, call us at this number. Maybe we can somehow mobilize the administration to do things a little bit more efficient than they are doing, because they are doing things.
Yeah. And just to remember, because there is Chloe now giving us a kind of reminder, it's about where to go is a kind of application and from the program Be Well Activity. And when we go there, she gave us the link. Thank you very much, Chloe. We can see what is the activity and what we can do. But as you said, Athanasios, more short measures, but more focus can help also every day to see it everywhere in the different building. It's true.
Absolutely. Absolutely. So, colleagues, as we are now at 2:30, is there anybody who was shy enough not to raise the hand and would like to have a last question? Probably they have gone walking all, and they are not here to ask questions.
Yes.
But it's, I mean, when we are participating in this kind of presentations, I have personally the feeling the need to go out, to walk, to go take my bike. We are lucky enough to have San Cantener and Park Leopold very close to our offices, and it's something that we have to use even more. Maybe even as trade union, we can arrange walking days,
Yeah,
or you know, even to socialize, to meet people. Let's walk all together, have 30 minutes of walk in the park, bring your friends, bring your lunch pack, and these are good ideas, very simple things.
yes.
And I mentioned some time ago the north of Norway, where it has snow 10 months a year, and still they are doing a lot of sports. I have lived there for 2 years, and one of the things that Norwegians were saying is that the best things in life are the free ones. Those that are free. You don't need to pay to go and do cross-country skiing. You don't need to pay to go out walking. You don't need to pay to go swimming. And we have to put that also in ourselves in our mind, that you don't need to subscribe to this very expensive gym in Voluve or in the city center to do sports. You can, Jan, please.
No, just to comment on that. It's in Finland they say there is no bad weather. It's all about bad clothing.
Exactly. Absolutely. Very good. Rashida, if you would like to have a closing word from me, just many thanks, colleagues, and Jan and Strahil especially for doing this webinar, or preparing it, and we feel that we will talk again very soon.
Yeah. Thank you, Athanasios. Thank you, Jan. Thank you, Israel. Thank you, colleague.